Hi, my name is Dr. Lynne Wray and I'm a sexual health physician and I work at Clinic 66, and the things that I am interested in are sexually transmissible infections, HIV, and in particular women's reproductive and sexual health. And I have particular interest in vulval and vaginal conditions, and I do a diagnostic test called colposcopy, which is the follow-up you have if you've had an abnormal cervical screening test. This morning we're recording a Q&A session on the topic "All it itches is not thrush." Why did we choose that? I guess because it's probably one of the commonest questions that we get asked by our patients. Have I got thrush? Have I got something else? What's going on? And also when we look at data from the Royal Australian College of GPs, we find that women attend their GP at least once or twice a year because of vulval or vaginal symptoms. So I think there's sort of lots of things we could hopefully clarify around that topic today. What is thrush? Well, the correct name for thrush is Candida, and most cases of thrush are caused by a variety called Candida albicans, but around about 10 to 15% of cases are caused by a variety called Candida glabrata. And that's actually important because glabrata does not respond as well to the typical short course treatments, either topical, vaginal or oral antifungals that you could normally use over the counter. So one of the very important things is if you've used a topical treatment or taken an oral antifungal one-day course of treatment and your symptoms come back very quickly, don't retreat. Go and see your GP and have a proper swab done to find out exactly which type of yeast is there. So that's one very important thing. Why do we get thrush? Well, we do have the organisms there, the yeast spores there in the background environment of the vagina, and the acidic environment of the vagina is also important for the yeast to be able to be present and also to cause symptoms if it overgrows. And the times in life when we tend to have more problems with thrush are after the onset of our periods and up until menopause. We don't see much thrush after menopause unless women are using hormone therapy to manage symptoms of menopause. But the other group of women who can have problems with thrush when they're older are women with diabetes who are on some oral agents to reduce their blood sugar level, because some of the modern very effective oral agents cause an increase in the excretion of glucose in the urine, and glucose is the food for thrush. So that can encourage that to happen as well. So it's important not to think, oh, I'm past menopause, I'm too old to have thrush, particularly if you have diabetes and type 2 diabetes. I would recommend that you double check with your GP and have a few more tests done. Why do I keep getting thrush? Again, a difficult one to answer. Sometimes it could be because the course of treatment was not long enough, your initial course of treatment, to get rid of all the overgrowth of the yeast in the vagina. And that's perhaps a little bit more likely to happen if you've had to take a course of antibiotics for another infection, chest infection, sinus infection, urinary tract infection. And perhaps there might be, takes a little bit longer for the vaginal microbiome to get back to normal again after you've taken your antibiotics. So that if you self-treat for what you believe is thrush and your symptoms do recur again within 2 to 4 weeks, it is best to go to your GP, have a few tests done, and then think about perhaps having a longer course of treatment. There are a small group of women who will have more than 4 or 5 episodes of thrush a year. And in that group of women who we say have recurrent Candida infections, it's often very, very useful to take a longer course of oral antifungal agents. And by a longer course, I mean one that might last for 6 to 12 weeks or perhaps even up to 6 months, in order to completely get rid of the infection and stop the bacteria, the yeast, regrowing again once the antifungals are stopped. But again, that's something that you can talk to your doctor about and have the right program for yourself set up, and hopefully get a really good result. Yes, it can be very frustrating if you have symptoms that you think might be thrush. You're noticing itching, burning, stinging, swelling, often after intercourse, and some discharge and that. And yet the swabs are coming back that are showing that there's no bacterial vaginosis, no candida, no sexually transmissible infection. And in that setting, we need to remember that the vulval area is normal skin. It's part of the skin on our body, and it can be subject to all sorts of dermatological conditions, just like you can notice elsewhere. So if you had eczema as a child, or you have psoriasis, or you have allergic reactions to certain chemicals, then that might be what's causing your symptoms. So I think it's really important that if you're having symptoms that are recurring and then either not responding to treatment, or the tests are suggesting that there's no infectious process, that you don't give up, that you do continue to see your GP, that you get your GP to have a really careful look at your skin and examine it carefully. If you find that as many people often say, oh yes, but the day I finally get my appointment at the doctor's, there's nothing to see, then I think sometimes, and I really do advise this with a great deal of caution, and I want you to do this very safely. Taking a picture when your symptoms are at their worst can be really, really helpful. But that picture is only for you to show your doctor, and as soon as you've safely shown that picture to your doctor, do delete it, so that there's no risk if someone else picked up your phone and looked at your photos. But it can be incredibly helpful, because I know how frustrating it is to come along and say, well, I had all these symptoms and today I'm fine, and know that examining you today possibly won't find the answer. The question about treating partners for thrush is a little bit of a sort of a tricky one. And I'd have to say that if your partner's uncircumcised, then it's potentially possible that he might have some yeast under the foreskin. But again, even a circumcised partner can complain about some itching or discomfort after sex if you do have a yeast infection. And the commonest thing that they'll notice is some slight itching on the head of the penis. They might even notice some little red dots or spots that last for a day or so after they've had sex. So if your partner's complaining about those sorts of symptoms, it's well worthwhile for him to use some topical antifungal cream at the same time as you're having treatment. Group B Strep is what we call a commensal. It's a bacteria that we can have on our skin, and also we can have in our vagina, and it normally doesn't cause any problems. The one exception being, however, that if Group B Strep is in the vagina late in pregnancy, it can cause a risk to the newborn baby if it's transmitted along the birth canal. So that a woman who's pregnant and has a test for Group B Strep, it would always be treated, and your antenatal care people will take optimum care of that. If you're not pregnant, we normally would not treat it, because you could take some antibiotics for it. It would reduce the numbers of the bugs, but they'd be back again within a couple of weeks, because they're actually part of your normal vaginal, what we call environment or microbiome. In rare situations where someone's got a very, very unpleasant and irritating discharge, and the Group B Strep is the only thing that comes up as a potential cause, then you might be treated with a short course of broad-spectrum antibiotics by your GP. What about BV, or bacterial vaginosis, as is the correct name for the condition? Well, it is actually the commonest vaginal imbalance or / infection that we do see. It's actually more common than a candida or yeast infection, but it's a little bit different in the symptoms. It doesn't tend to cause itch or burning or stinging, but there can be a watery greyish coloured discharge, and the most important feature about BV is that it does have an unpleasant odour, a slightly ammonia or fishy type odour, which people will tell you is very clinging, in that they may have just had a shower and notice that they can smell the odour again already. And people will often come and say, I'm so worried that other people can be aware of this odour because it's just, to me, feels so strong. And so BV, again, it's difficult because it's certainly present more commonly in people who are or have been sexually active, but at this point in time, it's not strictly speaking classified as a sexually transmissible infection. Patients often will come in and say, I've had treatment for BV, but within a week or two it's back again, and then I have some more treatment and then it's back again, and then, what's going on? Why won't it go away? And I guess if we knew the answer to that question, I'd probably be very wealthy, because I'd have a magic answer to that situation. We know that BV occurs because there's an alteration in the normal acidic pH in the vagina, and that the pH becomes more alkaline, and that allows the bacteria that cause the symptoms of BV, the discharge and the odour, to increase in number. So that change in pH is important in causing that, but what causes the change in pH is often difficult to know. Can it be related to your natural hormone levels? Well, possibly, because we know lots of our patients do notice the symptoms around the time of our period. Could it be related to having sexual intercourse? Definitely, we do know that if you're having sex without condoms, then semen is quite alkaline, and that alkaline semen can alter the balance within your vagina and within the microbiome there, and lead to an overgrowth of the natural background bacteria. So it's a fairly complicated story about, why does it keep coming back, and what's the best way to get it to go away. And the best way, I think, is to have a good consultation with your GP. Have all the tests done to check that you don't have an STI that you're unaware of hiding in the background, that you don't have yeast, and then looking at the actual pathology test results, designing a program with your GP of how best to treat things. Recently, there's been more interest in whether or not we can use probiotics, or whether we can use acidifying agents to help reduce the recurrence of BV. And that work's still in its infancy at the moment. But there is a new over-the-counter product that's showing some good early evidence of being effective for helping to reduce the frequency of recurrences of BV, and it's often something that people like to use because it's not an antibiotic, so it's not going to upset their normal sort of bacterial balance. And you can talk to your GP about whether or not that particular product is suitable for you to try. So going back to our theme for the talk that we started with, all that itches is not thrush, I think we really should also remember not to forget that we can inadvertently cause our symptoms with things that we do, things that we either do to our skin or things that we put on our skin. And it's very important to remember that soaps, body washes, body oils, shampoos, all those types of things can irritate the skin in certain people. And so we really recommend that you don't wash that area with anything that's soap related. And that includes the soap free, all the myriads of soap free things that you can use. Now you'll be shrugging, you'll be screaming, you'll be saying, no, but I won't be clean if I don't use all of those things. And you need to remember that the vagina is self-cleansing. The discharge that you see every day is part of the removing anything from the vagina that doesn't need to be there. And on top of that, cleaning the vulva under the shower with just some lukewarm water, not too hot. Hot water causes irritation of the skin too, but with some warm water. And if you really can't not use something on your skin, then something very, very innocent like some aqueous cream or some plain sorbeline cream on a natural sea sponge, which you can both wipe away any secretions under the shower and also moisturize your skin at the same time. Things that you won't possibly realize that can also irritate your skin are very, very common things. Perfumed toilet paper, panty liners that are perfumed or have a lot of plastic reinforcing to make them waterproof and spill proof. They can cause a problem. Tampon strings, perhaps clothing, particularly tight clothing, lycra clothing, G-strings, because the G-string rubbing along your skin can cause some irritation and abrasion and itching and soreness of your skin. There's lots of things like that that you may not necessarily realize that could be causing some irritation. Other things too, of course, condoms. Whilst you may not be allergic to latex, perhaps the actual lubricant on the condom, or if you're using flavored condoms or textured condoms, could be causing some irritation. Lubricants that you might use for comfort with sex, in some people can also cause irritation of the skin, because it's the things that are put into the lubricants to stabilize them and make sure they don't grow bacteria that are likely to irritate your skin as well. So a general rule is don't put anything down there that you wouldn't put on your face, because I think that's a pretty safe rule. And if you are going to put a moisturizer or a cream in that area of skin, it's good to do a personal patch test. Go to the inner aspect of your wrist, just under where you'd put your watch band, and rub some of that cream or moisturizer or whatever you're going to use into a 20-cent piece area. Do that 2 or 3 nights in a row. If there's no reddening, itching or irritation of the skin, it's probably quite safe to use. But if there is any irritation of your skin, don't put it on your vulva. So if you're thinking about vulval or vaginal symptoms and you're wanting more information, you're not sure what's normal or whether or not the problem you have is something that does need you to see your doctor, I think first thing to do is go to your Clinic 66 has its own website, which has a lot of really, really useful information about all sorts of reproductive and sexual health issues, including other sites where you can go to get further information about vulval and vaginal symptoms. And some of the good sites for that you'll find on the webpage: Jean Hales Foundation, the Melbourne Sexual Health website, the Family Planning New South Wales website. All of those have really, really good information that will help you to decide whether something is within the realms of normal or that you do need to go and see your doctor and get further advice.